Hey guys, what's going on? It's Epic Hazard Gaming, and today I want to play some more online surgery simulators. So, today, in our goal of getting through the 13 actually, these 7 and then the other 6, but in our goal, we're going to do game 5 now. At least I am. And I also want to point out to you guys, in my last 2 videos, I'm using QuickTime Player to record my screen and my voice. Well, every time that I hit the record button, it'll pop up and say, click to record full screen or drag to record part of the screen. Well, up here, I would always click just to do the full screen. But up here, this thing would take a second before it turns black as it is to indicate that it's recording. Well, in this video, I had waited until it turned black to start my, hey, what's going on, guys? But I wanted to point that out to you about my last 2 videos. Let's get right into it. Your first patient today is Jeffrey Norton. He's 15. He was born with a rare condition, anatomical leg length inequality. That means one leg is shorter than the other, so Jeffrey stands off balance and suffers lots of back pain. Well, just right here, leg length inequality, you can already get, well, the length of both the person's legs are unequal. So, today we're going to change his life. You'll perform a surgery to make both legs the same length. Alright, let's move this x-ray. I am not reading that big paragraph down there. Alright. To start evening out Jeffrey's leg lengths, we need to cut his tibia, but we can only do that if the bone is strong enough. A bone's thickness indicates its strength, so let's measure that now. Grab the caliper. "19. Size chart." Yes, I've already tried this through a little, but alright. First of all, we need to make sure the bone won't move around after the procedure. It could get crooked. We need to fix the bone in place within, holy crap, whatever that word is. Ilizarov apparatus? You've got to build it before we start the surgery. The pieces should fit together perfectly, like puzzle pieces. Copy the picture and you'll be fine. What? Oh, it wants me to do all this first before I do the scaffolding. Basically, I'm looking at this in a different way. Oh, these rods are so tiny, they're hard to put my mouse over. I guess if I even put it up, I guess if I put it down here even, or way up there, yeah, it's just gonna put it where it wants to. Tighten the bolts with a wrench to make sure the frame is sturdy enough. Wrench. Tight, tight, tight. Whoa, that's a lot more than what I had done. I only clicked in one place, not three. Let's tighten, tighten, and tighten, tighten. Let's tighten this up. Giggly saw. Ooh. That looked kind of... Before starting, we need to sterilize Jeffrey's leg. Select the tongs. Grab a cotton ball and dip it in iodine. Grab... already have. And dip it in iodine. In the iodine. Alright. It's kind of odd that we have to do the entire foot. Alright, we won't need to open up the entire leg, but we'll need to make some small incisions to access the bone. We can't risk damaging his knee, so make sure you're far enough away from it. Alright, there and there. Pick up the scissors. The incision must be big enough for us to work with. Opening and closing the scissors should do the trick. Ooh. Now leave those scissors there and grab a second pair. This is... ugh. That's perfect, Doc. Remove the scissors. The incisions are aligned, but we'll need a bit more room to work. Stretch the incision just a little wider using a steel pin. Use a hammer to tap it all the way through. Oh! God! Oh, that looks brutal! Time to cut the bone, Doc. We'll need the giggly saw for that. This is a delicate operation you'll need the pliers for. Pliers? Ooh. Another set of pliers for that. Just hold it. You can't pull it through if you're still holding it on the other side. Let go first. Alright. That's it. Now attach the handle so you can start sawing. Saw the bone by moving it back and forth till it pops. Oh God. Oh God, it's brutal. Now we need to get that saw out. We can't reuse it, so cut it with the pliers and pull it out. That's what you said. Alright guys, I'm going to redo this. I want you guys to see this. You're going to see. That thing just said cut it with the pliers. I'm going to work through this quickly because you've already seen all this. Take an x-ray of both the legs combined just cause. These rods are so small. Alright, tongs, cotton ball, iodine. Stretch the incision a little wider with a steel pin. Pliers. Giggly saw. Here we go. Look at that. Right there. I'm actually going to screenshot this. Right there. I screenshotted it. Look at that. Right there. Nice, Doc. Now we need to get that saw out. We can't reuse it, so cut it with the pliers and pull it out. Now watch this. Oh, cutting pliers? Aww. That's already out. Inserting the rod is pretty straightforward, but you'll need to use a bit of force to get it in. Put the pin in position. Use the hammer to get it all the way into his leg. And it's in. Great job. Alright. It's almost time to attach the Ilizarov apparatus to Jeffrey's leg, but we have to find exactly where it connects to the rod. There's a marker on the rod that shows up in x-rays, so we use the x-ray monitor to find it. The surgery is at a very important stage now. The Ilizarov apparatus has to be attached to the leg with a series of pins or else the bone won't heal straight. Put the first pin into position on the spot you marked. The pin must go through a layer of soft tissue made up of muscle and skin. Use the hammer to tap it through. Oh God, a surgical drill? The heck? That's the frame to Jeffrey's leg. Wrench. Oh God. Right through, right next to his ankle. Oh, this entire thing looks so painful. Oh, oh, and the sound of that drill. Oh, I just don't want to imagine the pain of it. Uh, oh God. Oh God. You're just mutilating this person's leg. Oh. This is a person's leg here. Oh God. Oh. That, people, that was disturbing. And it looked so painful. Let's do it on hard mode now. I'm going to have to remember everything. Alright. You already know. Alright, let's test my memory out. There, take the x-ray right on it. Caliper 19. Size chart right there. I'm a doctor, but I also have to be an engineer apparently. And build this device. It seems as though I'm going to mutilate this boy so badly. I'm actually the same age as Jeffrey. So I know I wouldn't want to be around the age I am and have that happen to my leg. Why didn't they have it fixed earlier, though? Like, seriously, they could have. Tongs, cotton ball, iodine. Give me control over the leg again. Foot. Alright, alright. Yes. Ah, crap. Alright, people. You already know. I know this. I'm just jumping way too far ahead. Why? I don't know. Why. Let's operate hard mode. Let's do it. Next. This is on my path to become a master surgeon. There we go. Right on that money. Tongs, cotton ball, iodine. Alright. There. There. Scissors. There. Crap! I'm taking that off, people. I'm not restarting this entire thing just for that measly little thing. Steel pin, hammer, gotta put it through. Pull it back out. Pliers. Giggly saw. Pliers, other side. Pull that out. Pull that through. Handle. Handle. Alright, cutting pliers. Right there. Pull that out. That's already out. 60-degree angle. Steel rod right there. Pound that sucker down. Oh, that. This must hurt so much. Alright. X-ray. Marker. Alright. Steel rod. Yeah, we're going to be ramming this rod right through him. Surgical drill. Get the hammer back. Alright, suture that up. Alright, I do believe the steel rod. No? What? Can't be the wrench. But we're going down there. It's already that? Alright, people. I am making too many mistakes. To tell the truth, if I had done anything with what I had picked, that guy would be dead by now. And besides, I can do this in a faster time. Alright, people. This is a little harder. Just because it has to take more time. Yeah, I'm going to make it go way out there to 160 millimeters. Wrench. 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 And wrench. Tongs. Cotton ball. Iodine. There we go. Marker. There. There. Oh yeah, scissors. Scissors again. steel pin, put it in there, hammer the living piss out of it, because that would be the completely wrong angle. That would put it in so different way. Oh god. Alright. Giggly saw, pliers, pull it from the other side, let go of that, pull that down, handle, handle, hands, cutting pliers, there we go, pull that out, tap that, 60 degrees, alright, now, X-ray, turn it on, marker, got spot, steel rod right there, hammer the living piss out of it. Oh god, putting it in an angle like that, hitting it with a hammer like that, I mean, like look at that, the hammer's going down that way, down like that, oh god. Alright, wrench it, hammer. Why is this going in so barely? Should go in a little more than that. Surgical there, surgical drill there, and hammer, 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 wrench there, and there, and we're done, people. Look at that, 0 mistakes. I had 3 minutes 33 seconds left in time out of 6 minutes and 30 seconds. I got 21,300 points, and I got double score to get 42,600. That was a good game. Alright, next up on our list, skin surgery. And then after that we got heart surgery. Let's see if we can get to heart surgery by the end of this video. Alright, skin surgery. Let's play. Meet Casey. She was playing soccer when the ball went over an iron fence. While climbing over it, she slipped and impaled her inner thigh on a spike. Ugh. As wound is too wide and deep to stitch, they're going to do a skin transplant, also called a skin graft. I knew that. We'll take a thin layer of skin from a healthy part of Casey's body and place it on the wound so it will heal faster. The donor skin for this operation will be taken from Casey's other thigh. We need to disinfect that area first. Tongs, cotton ball. The area is now sterile and ready for skin removal. Marker. Gonna prepare the dermatome. Use the dermatome to remove a thin layer of Casey's skin. Pick up the dermatome. Holy crap. The blade guard should match the width of the marked area. Select the correct guard. That's the right one. That's the right guard. Now let's attach it to the dermatome so we can remove the donor skin. Pick up a screw from the table. Screw. Put it there. Another screw. Put it there. Screwdriver, obviously. This is just common sense. I'm going off on this one. Nice dog. Now we need to set exactly how deep we'll cut into Casey's skin. Make sure the dermatome's depth setting is 0.38 millimeters. Very good, doctor. We're ready to remove the skin. Pick up the dermatome from the table. That's a bit of skin. Pick up the scissors so we can cut the skin off. Grab that towel. Okay, now collect the harvested skin from the dermatome. Pick up the tongs. I have gloves on. Why can't I just pick it up with my fingers? I don't get that. Pick up another pair of tongs. Alright. Excellent. Now let's prep the skin for the transplant. Before we put the skin on Casey's wound, we need to poke holes in it using a meshing machine? What? Oh god. There we go. The holes in the skin will allow us to cover a wider area. We will now cut the mesh skin into the shape of the wound. Grab the scissors from the table. That's our end product. The meshed skin has been trimmed so it fits in the wound. Pick up the needle from the table. You see how slowly I'm needling that? I'm sewing that in there. It's just I'm suturing it so slowly, just to be so precise. You gotta be pretty precise on here. You got to. Next, we'll put a sponge over the skin to stabilize it while it heals. The sponge has already been cut to fit the shape of the wound. Pick up the sponge from the table. We need to suck the air out of the sponge. First, pick up the plastic sheet from the table. Plastic. Now pick up the air tube. Turn the vacuum machine to suck the air out of the sponge. Let's finish up by placing a soft cast on the wound. Soft casts. There you go. Great job, Doc. I'm sure the patient will be back on her feet again in no time. Woo! Yeah, no mistakes whatsoever. Let's play this in hard mode. Let's do it. Let's test my memory. Alright, impaled in her thigh, blah blah. Marker. Wait, what? Oh. Alright, people, yeah. I don't know why. I keep jumping ahead so far. I just keep jumping so far ahead for no reason. Alright, let's play. Let's operate. Oh, do I have to go through this all again? Alright, I'll go quick. Cotton ball. Ready for skin removal. Marker. I don't really care right now. I'm just trying to get through this. middle, screw, there, screw, there, screwdriver, screwdriver, alright, pick up the dermatome from the table, there you go, scissors to cut off the skin, off the collected skin, I'm going to get 2 times the usage on this now. 2 times the memories. Yes, we're going to hold up. Scissors. End product. Needle. There. And there. 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 I'm not going to say there for every single one. Yes, I am not. Just for those of you out there that's wondering and kind of getting maybe annoyed, I am not. Next we'll put a sponge over the skin. Sponge. Plastic. Air tube. Turn on the vacuum. Soft cast. Alright, let's play in hard mode. Alright, continue, continue. Alright, tongs, cotton ball. Marker. Dermatome. Middle guard. Screw. Here. Screw. Here. Screwdriver. Screwdriver. I should stop. Alright. Scissors. Cut away from there. Towel on that. Alright. Tongs there. Tongs there. A device to hold it up. Scissors there. And there again. Needle. There. Let's keep going. Next is a sponge. Put on there. Plastic. With an air hole for an air tube. Turn on the vacuum. And soft cast. Yeah, I'm done. 21,800 is my score. With the hardcore bonus, I get 43,600 more in points, totaling out to a 65,400. Let's go back and let's try and get number 7, the 7th surgery, the heart surgery. We Heart Gaming. Play the surgeon sim heart surgery if you heart cringing. I don't know why these games are all like this. Doesn't really make you cringe. Doesn't really gross you out. It's just human anatomy and it's realistic. Hello again, Doc. It's me, Nurse Laura. And I sure am glad to see you here at St. Flax Hospital again. If we team up like we have before, every patient in the hospital will be better in no time. Our patient today is Joe. He was born with a weak heart, which causes him to get tired a lot faster than other kids his age. If not treated, his condition will be life-threatening. Our patient today, that just said that, grab the stethoscope so we can check his heart condition. Heart. First, we need to sterilize the chest area. Pick up the tongs. Cotton ball. Dip it. Now we'll draw a line on Joe's chest to mark where the incision will be made. You need a marker. Alright, time for the incision. Grab the scalpel. Alright. Cauterizer. I know it's a great... Oh, there's one more down there. We need a clamp to spread the skin and muscles to reveal the rib cage. Grab it now. Yeah, you hear that? She's like, grab it now! Whoa! Okay, now take another clamp and use it to open the incision further. The rib cage blocks our access to Joe's heart. We're going to have to cut through it. The bone scissors should be perfect for that. Snip, 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 snip. Tongy, plate, tong, plate, tong, and plate. Before we can continue, we have to move his nerves out of the way with the string. Not in the way now. Let's tie back the other nerve. We're going to hook Joe up to this heart pumping machine during the transplant. Match the tubes based on color going in alphabetical order. Start with tube A. Literally, no offense to colorblind people, but only a colorblind person could not be able to do that. We need the sharp-tipped scissors. Attach it to the tube. We need the sharp-tipped scissors. Wow. They're amazing. Wow, those sharp-tipped scissors are amazing. They sure are different. Take off that heart. Alright. Put the new heart in the patient's chest cavity. Perfect fit. We suture thread now. Alright. Bone stapler. Stapler. Bone paste. Alright. Stitch this guy up. Got to hand it to you, Doc. The operation was a big success. I'm sure the patient will make a full recovery. Even better, he'll be able to run and play sports like never before. Alright, 4,900 points because I only had 49 seconds left, but let's reload this. Let's see if I can play hard mode this time. If I can't, we'll know. We do have to log in. Well, we've done the heart surgery. Now we need to do 6 more. 7 more. It only says 6. Tonsil surgery. I have actually had this. I've had my tonsils removed before. In the past. I've had my tonsil removed before. Tonsils. Is that like a little devil character thing? Because if it is, operate. Because if that little devil character, if it is a little devil character, it's crazy. Meet Scott. Scott had tonsillitis. This caused an infection in the tonsils. To avoid complications, we must operate and remove the tonsils. Okay, doctor, let's get the patient to the operating room. It should be one of these 3 rooms. Please select the anesthetic mask from the table. Select the right amount of anesthesia that the patient needs. Move the valve until the needle reaches the green zone. Let's wait for the patient to fall asleep. Great work, doctor. Now you must select the breathing tube from the table. Select the retractor from the table. Retractor. Now, good. Now we're ready to remove the tonsils. Select the forceps from the table. Select the cauterizer. Cautery. Now use the cauterizer to cut the tonsil. Good. Now select the guillotine clamp. Cauterizer. Now we must remove the other tonsil. Please select forceps from the table. Cauterizer. You can use it to burn away things and cut it and stuff. Or you can use the cauterizer to stop blood. Heat is amazing, ain't it? Now select the water spray. Water spray. Now we must select the surgical suction from the table. I don't know. Maybe I just want to sit here for a few seconds and let him drown. Nah, I ain't gonna let him drown. I ain't a monster. Now we have to go to the hospital's pharmacy. You must select the correct post-op medicine for the patient. Ibuprofen. You've done a great job, doctor. Liquid ibuprofen is a medicine that can be taken every 6 hours to hydrate the throat and help suppress pain. I'm sure the patient will recover in no time. 20,500 points. Alright, let's play this as a specialist. Let's get it. Let's do it. Alright. Alright, you just fall asleep now. Breathing tube. Retractors. Forceps. Pull that sucker out. Cauterizer. Burn that sucker out of there. Guillotine clamps. Oh yeah, cauterizer for the blood. Alright. Forceps for the other one. Cauterizer back there. Guillotine clamps. Cauterizer. There. 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 Water spray. Surgical suction. Move the clamps and move the tube. Ibuprofen. There we go. 23,900 score was 0 mistakes and a final total score 47,800. That says arm surgery 2. I'm not on arm surgery 2. Alright, tonsil surgery. Let's go number 2. Let's see if we can do it. Knee surgery. Surgery, same game. It feels like when the doctor taps your knee to get a reflex, except this is more like a test of your gag reflex because you'll be grossed out. Knees, armpit of the leg, no. Knee, stomach, arm surgery 2, brain surgery. Dental surgery, we've already done dental surgery. Alright, let's play knee surgery. Alright, let's play this. It's probably going to be the last one for the episode, but operate. This is Steve. Steve fell while trying to perform a stunt on his skateboard and landed on his knee. He has a lot of pain, so we will need to check his knee for potential serious damage. Let's take him to get an x-ray. Okay, doctor, let's x-ray this knee. The machine is located in one of these 3 rooms. Boop. Good job. From this image, with can see that there is damage at the right side of the meniscus. It's from this image we can. It's not with. Stupid coders. This is going to require an operation. Let's get Steve to the operating room and prepped for the surgery. The room should be behind one of these doors. First, we need to clean any hair from the knee. Please grab the shaving cream from the table. I don't fill it in either. I don't do this with it. Great work. Now you can apply the antiseptic solution. Before we begin surgery, we need to sterilize the area around the knee. Please pick up the tongs and cotton ball. That's right. Now that the area is clean, we can inject an anesthetic to numb Steve's knee. Obviously, the anesthetic needle. What we need. Now we wait a moment for the anesthetic to start working. Great work. We will now make the first incision. Pick up the scalpel. Great work. Now please pick up the cannula. Now that the knee is filled with saline solution, the next step is to make 2 new incisions in the knee. Alright, picking up the scalpel. Alright, now we need to insert the arthroscope into the knee to see the meniscus. Please pick up the arthroscope. Meniscus. There you is. We can now see where the meniscus has torn inside the knee. We will need to cut off this torn section. Please pick up the hook scissors. The hook graspers now. Very good, doctor. Now we will smooth out the remaining meniscus. Pick up the rasp. Nicely done. Now you can remove all the equipment from the knee. Let's suture the incisions. Suture needle, obviously. Pick up the thread. That one, and that one. Pick up the adhesive strips. Bandage Steve's knees. Please pick up the bandage. You've done a great job, doctor. I'm sure Steve will recover in no time. 10,300 points for a score. Let's play as a specialist. Let's get this one time done. I think I'm going to end the episode off after I'm done with this. Yep. Meniscus. Shaving cream. Razor. Pull that down. Alright. Now, tongs. Cotton ball. That. Alright. Anesthetic. I nearly just clicked scalpel. Wait for the anesthetic to take effect. And scalpel. Cut. Alright. Cannula. Alright. Scalpel. Right there. Right there. Arthroscope. I'm playing this way again because I believe I was just treated unfairly. It wouldn't work. It did not do it the way I was moving the mouse. It's one thing with these games though. Oh, crap. Alright. I'm gonna have to mess this up. I'm gonna have to wait for the stupid arthroscope before I can actually do anything. Again, to restart this, because I am going to. I'm gonna restart it. I don't know if I reload the page, if I will still be able to, you know. There. Play as a specialist. Alright. Now I'm going to restart it, and I'm going to get it to go through in well good time this time. X-ray. Yep. Meniscus. I could tell from that X-ray. Yep. Just put it down everywhere already. Razor. 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 Tongs. Cotton ball. Anesthetic. Scalpel. Cannula. Scalpel. Right, now arthroscope. Alright. Now, hook, scissors. Hook graspers. Rasp. To smooth it out. I can take that one out. Now I need suture needle. And thread. Go through there. Through there. And through there. I need some adhesive strips. There, and there. Then you need bandage and put it right there. Done. Oh! 0 mistakes. 14,500. And with the hard mode bonus, I get an extra 14,500, coming out to a grand total of 29,000 for a score. Alright, guys. Next time, we're gonna have stomach surgery. And no, this is not appendix. This is actual stomach surgery. But I'm gonna leave it off leave the video off here. I hope you guys have a great day, and I'll see you in the next one.